Okay, so now we're going to be showing the positioning of a shoulder joint mob, which we will not be doing on the patient due to hypermobile, hypomobile ability, which can actually end up harming the patient more than helping. So for your hand positioning for a posterior glide joint mob, you want to get the patient's arm in between you and your arm. And you want to really palpate for that joint line in there, so that might require you to do a little bit of moving in that abduction range. And it's best to have the patient within line of your ASIs, that way you get a firm grip, and then also you're able to get a better of a hand position. So you're going to get your arm right up into that joint line and center around it, and then when you move posteriorly, you want to be more on the anterior side along the that joint line there, and then you're going to use your pressure to push downward till you feel an end range, and then back up, and then from there on you move into your grades and your 2 to 3 oscillations per second for 30 seconds. Okay, so then for an inferior glide within the shoulder joint capsule, you're going to do the same where you get that arm right up against you and kind of holding it against you and being able to move into that joint line again just a little further down. And this time you're going to want more of a two-hand position just to help you move a lot better. So this is going to be on the top and this is going to be on the bottom, and you're going to be pushing in line with her truck. Okay, now for knee mobs, you're going to want to get your patient in a supine position, and it's going to be very much like an anterior posterior drawer, where you're going to position your hands right behind that knee, and you want to get your thumbs in a comfortable position right underneath that joint line right there, so it does require some palpation. And then when you are going, when you're testing the posterior, you're going to be wanting to push in, and when you're testing the anterior, you're going to want to push out. Once again, you're going to want to feel for the end range and then back off. And then depending on the grade that you want to end up moving into, your grade 4 with your 2 to 3 oscillations per second for about 30 seconds. So to simulate kind of what it's like for that oscillation and the grades, a grade 1 is very much just going to be barely depression and then doing kind of a slower oscillation, and a grade 2 is going to get deeper, and then a grade 3, and then a grade 4 is going to be your end range there, and that's when you're going to be the farthest, but you're not going to be as hard with your oscillations.